I've got one before you, and I have one myself. It's 0705, it's the RS number, and that is limiting the requirement to grant preference to a relative. Limiting the requirement to grant preference to a relative. Any questions? Any objection? Okay, we'll request that as a committee bill. Okay, now, Dan Murray.
Madam Chair, members of the committee, my name is Dan Murray with Divine, Donnelly, Murray. Thank you for the opportunity to request a bill introduction. It is 23 RS 0960, and it relates to the request and issuance of birth certificates for children in need of care in adoption cases.
Okay, committee, do we have questions? Any objection? Okay, thank you. Further introductions from our guests? Anybody? All right. We'll jump right into, we've got a bill hearing, House Bill 2240, requiring the clerk of district court to give notice of qualified residential treatment program placement. And we'll start off with Jesse giving us an overview.
Thank you, Madam Chair. Good afternoon, committee. It is my pleasure to spend only approximately 15 seconds of your time. The change in House Bill 2240 requires that the clerk of the district court give written notice whenever a child has been placed in a qualified residential treatment program. Currently, the statute says written notice shall also be given to, and then lists the intended recipients. The change in the bill would state the clerk of the district court shall give written notice to, and then following that same list of intended recipients. So I am available for any questions the committee has on the bill.
Are there questions for Jesse? Okay, thanks. Okay, proponents, we have up first Tanya Keys with DCF. Hi, Tanya.
I'm so sorry. Our case management entities would send a notice to the court. The court then is the entity who provides notice to parties. And simply this bill would state the practice that is currently going on, that it is the district clerk who provides that notice to the parties. I have provided you with a little bit of data and a map if you're curious where those qualified residential treatment programs are located, and happy to answer any questions at the appropriate time.
Okay, committee, do we have questions regarding this? Representative Humphreys.
Thank you. So now this is what's happening anyway, but it's sort of ambiguous. Like, are you supposed to do the written notice, or is the clerk? Is that what you're cleaning up?
Yes, that is what we're cleaning up. The court has been sending these notices, and it has been interpreted that the court sends notices to the parties because DCF is not a party, and we don't always send notices to parties. So how it's been operating since approximately October of 2019 is the court has been providing those notices.
Thank you. Thank you, Madam.
Further questions? Okay, thank you. So this is one of the hardest bills we've ever had in this committee. There are no further proponents, and I show no neutral and no opponents. And so I'm going to close the hearing on House Bill 2240. And committee will open the hearing on House Bill 2153 and ask Jesse to give us an overview.
Thank you, Madam Chair. Good afternoon, committee. So we are going to go over House Bill 2153. And as short as the change in the last bill was, that's how short the current law that this bill is amending is. So what this bill currently does, what the bill will do, it will authorize the Attorney General to coordinate training regarding a multidisciplinary team approach to intervention in reports involving alleged human trafficking for law enforcement agencies, and it requires training on human trafficking awareness and identification for certain child welfare agencies and other agencies. So the current law on this is one sentence, and it states the Attorney General, in consultation with other appropriate state agencies, is authorized to coordinate training regarding human trafficking for law enforcement agencies throughout Kansas. So what House Bill 2153 does, it requires a little more from the Attorney General. So more specifically, the bill amends 75-756 and a new subsection A that declares that it is the public policy of the state that law enforcement agencies implement a coordinated multidisciplinary team approach in these instances. Subsection B would change the current law to direct the Attorney General to coordinate training for the law enforcement regarding this multidisciplinary team approach. In reports involving alleged human trafficking, aggravated human trafficking, or the commercial sexual exploitation of a child. And then finally, subsection C of the bill, the new language, would provide that each fiscal year, certain persons shall be required to complete 1 hour of training on human trafficking awareness and identification that has been developed pursuant to the requirement in this bill. And the list of those who are required such training are employees or contractors with agencies who, in the course of employment, have regular contact with members of the general public, certain licensed mental health professionals and counselors. 3, all teachers, school administrators, and employees of educational institutions. And lastly, all persons licensed by the Secretary of Health and Environment to provide childcare services and are employees of those facilities. With that, I'm available for questions on House Bill 2153.
Other questions for Jesse on House Bill 2153? You just said it. Representative Ousley.
Thank you, Madam Chair, and thank you, Jesse. Can you remind us what we did regarding truckers and human trafficking awareness a couple of years ago? I didn't hear you mention anything, and I don't know if that's applicable here to this bill or if that was a completely separate issue.
Yes, Representative, give me one moment to look this over. Madam Chair, Representative Ousley, this bill does not speak to truckers or the persons you've asked about. And as far as previous efforts in statute that has been to address those, I'm not sure what is in current statute or what efforts have been made to address those issues.
I might do a little of my own homework. Thank you. Thank you, Madam Chair.
Further questions? Representative Howerton.
Thank you, Madam Chair. On the last section of that, the second page, line 2, where it says all persons licensed by the Secretary of Health and Environment to provide child care services. Is that daycare? So all daycare providers would have to go through this as well?
Yes, Representative Howerton. So in order to have a daycare, you have to be licensed by the Secretary of Health and Environment.
Okay, and who would pay for that? Is that something the daycare?
I know that there are licensing fees, and so I'm not sure if the department would put that into those licensing fees, but the bill is silent as to how those employees would receive the training and the costs.
Further questions? Representative Wagner.
Thank you, Madam Chairman. Kind of following up on the previous question. So there's not a fiscal note yet made for this bill, but you're requiring every school, it literally requires every school teacher in Kansas or every public school teacher, or maybe both public and private, all child welfare people for an additional 1 hour of training. I mean, again, this might not be your wheelhouse, but do you have any notion as to a fiscal note or when they might? I'm just thinking of the effective cost of 1 hour of all those people's time. I mean, that's a lot of man hours being devoted to this. And do you have any insight on that or who we would talk to?
Yes, so Representative Wagner, you're correct in that all teachers, administrators, and employees of any public or non-public elementary or secondary school or post-secondary educational institution are subject to this training, but the bill is silent as to how much that would cost or who would cover those costs. And as far as a fiscal note goes, I don't know what those numbers would be.
So there is a fiscal note if you look at the KS Ledge website, pull up Bill, House Bill 2153. No fiscal effect on State Board of Education. Oh, you can read through those. Any other questions? Yeah, Representative Neighbor.
In answer to the representative's thought or the conversation that we were having, it is possible to have staff meetings, and our staff meeting is not unknown, and to have a person come in and present to all the teachers in that building. So that would not be an extra charge unless there were supplies that were needed. So it could be done on staff time during school hours, and they have them usually once a week. So that's a possibility to cut costs, just FYI.
Okay, further questions? Representative Johnson.
Thank you, Madam Chair. Quick numbers check for myself on our daycare at my church based on salaries and the amount of time involved. It will be between $375 and $500 for our daycare to provide that training, which may not sound like a lot, but we're a very small facility because we have to pay all of those salaries and fit them in, and in some cases it constitutes overtime. Thank you.
Okay, are there questions for Jesse? Okay, thank you, Jesse. Okay, we'll open up the proponents with Michelle McCormick, the Office of the Attorney General. Hi, welcome.
Good afternoon, Representative Concanon and members of the committee. My name is Michelle McCormick. I'm the Director of the Victim Services Division at the Kansas Attorney General's Office. I also serve then in that capacity on the state Anti-Human Trafficking Advisory Board, where I've chaired the Victim Services Subcommittee and the Data Subcommittee for a number of years. Prior to that, I also worked at a private nonprofit where we served survivors of human trafficking directly with crisis services. So that informs my testimony today. I'll keep my remarks brief because you have my written testimony, but I wanted to let you know that, at the Attorney General's office, we've been working on the issue of anti-trafficking and intervening in human trafficking for a number of years. Have made a great deal of progress with strengthening laws and raising awareness and coordinating efforts around the state. In particular, as you heard, our office coordinates currently training for law enforcement officials. But one of the things that we know that sort of stymies our progress in this issue is that human trafficking is both underreported and underrecognized by, in particular, folks who are in positions to possibly help those folks who are vulnerable and being exploited. And we know that both labor trafficking and sex trafficking has been identified in Kansas, and so we think it's important to strengthen our response to this issue. I'll tell you that we know from the experts, both nationally and locally, that a multidisciplinary response is the most effective way in order to engage in this. And so basically what we believe this bill could do is strengthen and coordinate that multidisciplinary response. And so that all professionals, and in particular, as you can tell, this bill is really looking to engage mandated reporters to make sure that they have evidence-based and consistent training on the identification and awareness of human trafficking. And so that's what we think could really be accomplished here, is that we could strengthen the overall response by making making sure that all of those professionals who already work together are getting the same information about those risk factors and about how to report human trafficking when they recognize it. I think just to speak to some of the questions that have been raised, I also wanted to share it's the intention of the Attorney General's office. We provide this training for free to folks already at their request, and it would be the intention for us to probably, most likely, record a video or some sort of mechanism so that it was available for free from the Attorney General's website for those entities to access. Similar to the project that happened years ago with Truckers Against Trafficking, which did require CDL license holders to get minimum training on the identification of human trafficking. And so with that, I'm happy to stand for questions now or later if it's appropriate.
I think we'll go ahead and do them now. Committee, do you have questions? Yes, Representative Lewis.
Thank you, Madam Chair. Thank you for coming. How do you understand the term coordinated multidisciplinary approach or team? What does that mean?
Yeah, the way I think of it is similar to a model that you might be familiar with the child advocacy centers in Kansas, where you have a group of professionals, law enforcement, social services, healthcare providers, folks who are have different responsibilities in responding to the issue, come together and staff those cases in a coordinated effort. And so that's really what we're talking about, is sort of emulating that multidisciplinary response that happens when responding to child abuse cases.
So you may or may not have read the testimony of the conferee who will speak next, I think, but that conferee was concerned that the rural areas would have a problem implementing a multidisciplinary approach. Could you speak to that?
Yeah, I think, we don't specify exactly who needs to be on a multidisciplinary response team in that regard, so that it could be flexible to meet the needs of the specific community. And so, understanding that it's going to be look differently perhaps in some of our metropolitan areas than the rural areas. And so really it would just be designed to pull together those folks who are in that community that should be a part of that multidisciplinary response, but not sort of specify exactly what that needs to look like.
So,
Yeah, go ahead.
if I understand, you're suggesting that when the amendment says law enforcement agencies shall implement a coordinated multidisciplinary team approach to intervention, that in a rural area, if one agency wasn't available, it wouldn't, the text of this wouldn't require that they reach out to somebody, say, I'm in Garden City, to somebody in Kansas City to coordinate something that's going on in Garden City.
I didn't read the bill to say that that would be prohibited.
Or required.
Yeah, or required. Mm-hmm.
Good. Representative Wagner.
Am I correct that the bill requires an annual training for everybody? Is that correct? Okay. So I'm kind of curious. I mean, again, it's a very important topic. I would definitely grant you that. But as far as this training, I mean, there's sort of the initial awareness or additional awareness you'd be doing. But so every year there's going to be an hour's worth of new stuff that the Attorney General's, I mean, that I'm just a little bit probing why this couldn't be encompassed perhaps in some other training that mandatory reporters already see, rather than having an annual update of a full hour's worth of time, given the fact that you're talking, 20, 30, I mean, with post-secondary, you're talking like, I think literally almost 50,000 people, and just, again, that's a lot of man hours being devoted to this, and does that actually make sense?
Yeah, I think that's a great question. I think so. The recommendation was based on some of the recommendations that come from the national level, some of the advocacy groups, and the federal government who described just dynamics of folks needing to get a refresher on some of those identification what they're looking for. I do think it also, this is still a relatively under-researched area of practice, and so I do think that that allows an update for information as we learn more about what we're looking at. And so I think that was the thinking anyway behind the hour, is that it could allow for new information to be added as we learn it, but also a refresher for folks who've already had some of that information.
Representative Neighbor.
Thank you, Madam Chair. All right, so the program that you have developed, or that is developed, does it take an entire hour?
At the time, that is the minimum of the training that we have developed, that we provide now.
And do you have the supplies that go with that, and you will supply those to all of these groups at no cost?
When you say supplies, could you clarify what you're
Any
thinking?
paper that's required, written information, or you would put it online, something like that, to have access to?
Yep, the most common way that we provide the training right now is virtually, and then copies of the presentation get emailed out to the folks who are in attendance, and so there hasn't been a significant amount of funds spent on supplies in that regard.
And so if a group, say Representative, my mind just went blank, thank you, sir, his church group or the child care group wanted to have a presentation, would you travel to their facility to do that?
Currently, that is something that the Attorney General's office provides, and we travel around the state, and it's budgeted into our budget for those staff positions to travel around state if folks are requesting in-person training.
And I have one final question, ma'am. I know you've put in here, and Representative Wagner brought this to light, that do you really need an hour for updates and things? I would wonder if this says up to an hour, because it might not totally take an hour, but I understand having new employees, new teachers on board, and they would need that, at least that training. So could that be changed to up to an hour? And that would be at the discretion of the presenter.
Yeah, I think that's an interesting possibility to think about. The concern would be is like you're suggesting, differentiating between those folks who need the solid baseline training and those who perhaps need a refresher course, to make sure that folks are getting, the baseline information about everything they need to learn.
Thank you, Madam Chair, and thank you.
Representative Carr.
Thank you, Madam Chair, and thank you. In as much as I understand the need for this particular training, and I'm definitely a proponent of that, my questions kind of mirror those that have already been presented with regard to, for instance, those in-home daycare facilities. What kind of a time frame, and this is probably going to be a compound question, but what kind of a time frame between the time that they hire a new employee, what kind of a time frame are we looking at before that training is a requirement for that employee to work in that facility? Is that something that they will have to have prior to their employment? Is there a 30-day window? What are we looking at? And additionally, then how is that training going to be provided for that individual? Do you set up, are there like WebEx training that they take place? Is it something that they have to schedule individually, or do you run the WebEx training, like on a rotating basis so that you can get someone in? Just kind of speak to that with also the thought in mind that there will be costs that are then related to those individual care providers, and how are we suggesting that we absorb those costs?
To address your first question, Representative, I can tell you that our office anticipated coordinating the training, certifying that it's legitimate and quality training on this issue. But it was our intention that the existing licensing bodies were going to navigate how they were going to help those individual professions be in compliance. And so I don't have an answer to like whether they have to be in compliance within 30 days, because that would be different based on which licensing entity and what their requirements are for continuing education or baseline education. And so that wasn't something our office anticipated answering, but that would instead be up to those licensing entities. But to your second question, yeah, we were trying to figure out ways to make the training available and as accessible as possible. And so currently we do offer virtual trainings, WebEx trainings, and at the request of folks who want it. And so right now folks are doing that voluntarily, of course. They're requesting the training. And so certainly we would ask them to coordinate with our office. And I don't think our office needs to be the only training entity in that regard. There are other quality national programs that are also free and accessible to folks. And so perhaps we could also create a list of approved trainings that folks could substitute for the training provided directly by the Attorney General's office. But certainly there are a lot of accessible ways for folks to get this training now virtually. And so I think that's the most cost-effective way, given the amount of folks that we're talking about in the particular bill.
Thank you. Thank you, Madam Chair.
Representative Humphreys.
Thank you, Madam Chair. So a little bit different line of questioning. So Section C is what we've been talking about. That's the bulk of everything. But if you could just explain a little the language in A and B. Sorry, I think this is every word makes a difference coming out. There's just a couple words I don't understand. The law enforcement agency shall implement a coordinated multidisciplinary team approach to intervention in reports involving alleged human trafficking and so on. So can you explain, like, what is that actually saying, an intervention in reports? What is that referring to?
Responding to reports that get filed with a law enforcement agency that someone suspects or has identified human trafficking is the way I understand that.
Okay, so, all right, so going to have so besides the training piece, which is what we mostly talked about, the other piece of this, the other two pieces of this bill has to do with your office coordinating different law enforcement agencies and how they respond to reports as a team, I guess. Is that right? That's what A and B, Section A and Section B are mostly talking about?
Yeah. So the idea behind that was to just clarify, and I can tell you that this is already largely in practice around the state in our efforts with the law enforcement agencies. They already recognize that a multidisciplinary response to human trafficking is the most effective way to tackle this issue. This just formalizes that this is the best practice approach to law enforcement intervention to human trafficking.
And so now, like, what that team might include, what different disciplines?
Yeah, again, it's modeled after the Child Advocacy Center multidisciplinary team, and those teams generally consist of law enforcement, a DCF worker, perhaps somebody who, like a forensic nurse who is at a local hospital. They're folks who get appointed to that multidisciplinary team in the community.
All right, thank you. Thank you, Madam Chair.
Representative Johnson and then Lewis.
Thank you, Madam Chair. Two quick questions. On the section on teachers, administrators, and employees of any public or non-public elementary, that means every person that works for the school district, correct?
That's how I read it.
Do you realize how many people that could involve in a school district that have nothing to do with contact? That includes all maintenance, that includes the janitorial staff, part-time workers, would also include the definition of substitute teachers who appear just irregularly. Why is it put in that manner for that level of contact with a school district?
I think think out of an abundance of caution that those folks have interactions, in particular with youth and minors, even if it's not for the purpose of education. But I think, given the janitor example, they still have relationships, they still have contact with kids, and they may be picking up signs about what's going on. And so it really was out of an abundance of caution that those folks have contact or access to youth who may be victimized.
Comment on that is that it's a lot more extensive than you realize for an agency to administer that. Okay, then the next one is on the daycares. All persons licensed by the Secretary of Health and Environment to provide child care services and the employees of such licensees. Again, you have included a huge number, including part-time high school students, in my case, church members who are at the daycare. It is a very broad stroke, and again, it places a huge issue for, and if you're an in-home daycare, and we're currently in another committee, we are working on ways to reduce some of the training issues that have been imposed on daycare and that are costing them a lot of money. And while I totally support the bill and its concept as a former law enforcement officer, I think there are some issues here with the way it is currently written. And then finally, I'd like to comment, I'd like to see that the district court judges are required to also have this training, given the fact in one recent court case, a judge allowed custody of an infant back to a parent who just got out of prison for human trafficking. Thank you, Madam Chair.
Representative Lewis.
Follow up on Representative Johnson. Am I not looking at the same, you mentioned that it would require daycare, and I'm not seeing that in what I'm looking at, so I'm wondering if I'm looking at. So, as I read the statute, the first part talks about the Attorney General doing a coordinated, multidisciplinary team approach to human trafficking. And
Representative Lewis, is your mic on, or can?
It is on.
Yeah,
I'll speak more closely.
Okay, thanks.
Thank you. And then the second part is about all the training that needs to be done. Could you tell me if you know, I mean, it excludes law enforcement from that training requirement. That's my point. And is that because they're already getting this training, or you don't think they need it because they're informed generally?
No, I think it's because they're already getting it in the previous or the existing statute, that coordinated effort. The law enforcement agencies in Kansas are already getting it. We worked closely with the Law Enforcement Training Center to have this identification training built into the police academy. And so now any new officer who goes through gets this already in their training requirements. And so really this was to strengthen the other parts of that team so that they were getting similar or the same kind of training that law enforcement's already getting.
Thank you.
Mm-hmm.
Further questions? Representative Wagner.
Thank you, Madam Chairman. I guess I have one or two kind of data point questions. I mean, since you're in your testimony, you have experience with hundreds of people who have been sex trafficked. Is there not some sort of data point as to, like for people in law enforcement? I mean, as far as who reported these people to the police, as far as, was it somebody at a school, at a public school, or was it somebody from a daycare? I mean, from these different types of current operations, where are the places that people are currently identified? I mean, obviously in that type of work, the people would need training versus, I'm just thinking that maybe you're getting too far afield. I mean, plausibly, but I guess if there was some sort of notation as to our information as to the current reporting about people or allegations of sex trafficking, you know where they come from. Because I do know with child abuse, we had this in testimony here 2 or 3 weeks ago. I mean, it was, I think there were thousands of reports every year that come in, of which only a certain percentage were substantiated, but it was like in the thousands versus, I mean, on the sex trafficking, allegations, where that would be. As far as just the scope of this does seem incredibly broad, would be one comment. My other is that, I'm a small business owner. We're required to do safety training, for OSHA, for, PPE or hazardous chemicals training, things like this. But in none of those trainings are we required to do like an hour annually of hazardous training. There's just like a hazardous training requirement or hazardous chemical requirement, but there isn't a time frame. And I'm thinking that I'm sure school districts and others might have like an annual training that they do for just legality stuff that this could be incorporated into rather than specifying a certain amount of time, just given, the tons of people that this bill would require to receive such training. So, are any comments on that or?
Yeah, I can tell you that one of the things we had looked at when we were conceptualizing some of this is that, schools, for example, already are required to do 1 hour of training on, suicide prevention, intervention, recognition through the Jason Flatt Act. And so there is a precedent already for sort of this kind of model for those folks. And so we were considering some of the existing structures that already exist to make sure this professional education and the training requirements are met by those folks. As far as data points go, actually this is an attempt to sort of solve one of our bigger challenges in the area of human trafficking in that we don't have coordinated data systems in the state on this particular issue. And so you can ask, for example, the KBI reported to me recently that they received 35 reports from the National Human Trafficking Hotline saying that 35 reports of human trafficking had been identified. But during that same state fiscal year, the victim service agencies who receive grant dollars from the Attorney General's office, very limited pool of people, they reported identifying 418 victims of human trafficking that were served. And then local law enforcement has their numbers, and we're all challenged by the fact that we have different confidentiality requirements, and so we can't, even if we all dumped all of our data into one system, we would be challenged then by what's duplicate data. And so that's one of the challenges is getting great data. And this, we think, might be getting folks, those response professionals, on the same page at the foundation level about knowing what they're looking for is a positive first step to get us in the direction of having common definitions, common identification, so that we can get to the place of really getting our arms around the prevalence of human trafficking in Kansas.
Representative Underhill for the last question.
Sorry, thank you, Madam Chair. Something you just said. So is your training or the other free training that's out there, is that qualified continuing education for some of these licensed professionals that are required to have CE hours every year?
That's how I think of it. I think that each of those licensing entities probably have different definitions about what qualifies. And there's a process. For example, the attorneys in our office, if they need CLEs, the training has to go through the CLE commission to get approved. And so there are going to be different processes for each of those licensing entities. But I can tell you that many of those organizations have accepted the training we've already provided as counting towards those continuing ed requirements.
Okay, I think we'll move on. Thank you very much.
Thank you all very much.
Next up, we have Ed Klump with the law enforcement organizations. So, welcome.
Thank you, Madam Chair. Committee members, appreciate the opportunity to be here. I'm not sure everybody knows me in this room, so Madam Chair, if I might, I'd just do a brief introduction. My name is Ed Klump. I represent the Kansas Sheriff's Association, the Kansas Association of Chiefs of Police, Kansas Peace Officers Association. I was a 35-year career officer in law enforcement, 2 of that in Lawrence, the remainder of it here in Topeka. Last 5 of my years here in Topeka, I was chief of police. And after I retired, somebody suggested that since I lived in Topeka, it'd be good for me to come up on behalf of the associations and visit with the legislators once in a while, and that morphed into what I now do. And so that's kind of my history in the law enforcement area. In human trafficking, I am a member of the Human Trafficking Advisory Board in the Attorney General's office. I have participated with them, DCF, DOC, and others in doing training on human trafficking across the state. We've spent, Michelle, maybe 6 years or so going out to law enforcement agencies trying to provide training on this human trafficking to existing officers. And like Michelle said, the new officers all get this training when they go to the basic academy. And so that's kind of my experience in this. So what I'd like to do is, you have my testimony there, but what I'd like to do is I'm going to skip subsection A and come back to it because we're going to get hung up on it. I want to take subsection B first. First of all, when we met, our associations meet every Friday morning by phone, and we had a pretty lengthy discussion about this bill, and adamantly we support the bill in concept. We support the need for training. We support the need for coordinated training. We support the need for awareness. This is one of the most underreported crimes there is, especially among violent crimes, and awareness is what is key to that. I tell people when I go out to do my law enforcement training, when I first started in law enforcement, and I look back now knowing what I know about human trafficking, there is no doubt in my mind that many, many children I dealt with as an officer, as consistent runaways and things like that, were being human trafficked. No doubt in my mind. No doubt in my mind that a lot more of them were being sexually abused in the homes. And the awareness just wasn't there. Yes, we'd run into that sometimes and recognize it, but if we had the training then that we had now, we would have recognized a lot more. It's a very important aspect of this. So subsection B goes to adding this multidisciplinary team approach to that training that the AG's office provides. And like Michelle said, we've been engaged in that. I've been engaged in going out and doing some of the training with them and other organizations on multidisciplinary. I had another experience in multidisciplinary teams, and that had to do with a group we were working with, and I continue to work with, on drug addiction problems across the state. And we did some things where we pulled together a conference, and we invited anybody to come to it, but to come to it, they had to bring with them at least a member of the sheriff's office, one local agency, if they had a local agency in their county, a judge, and a prosecutor. And we would do our training, and then we'd set them together to start developing a multidisciplinary team. And it was very challenging. And what we learned in that was, first of all, you need a champion. And that champion isn't always law enforcement. It isn't always a judge. It isn't always a prosecutor. It isn't always CAC. It isn't always your local mental health center. It's different in every community, but you need a champion. And so it's very, very challenging as you get into the rural areas to form these. Subsection C has nothing in it about law enforcement, but I'll just go back to the awareness piece. Awareness is important in identifying victims of these crimes, and anything we can do to enhance that. I'm not saying everything in C is right. I'm not going to opine on that, but awareness is a key component to this. So let's jump back up to subsection A, which is what I really want to talk about. When we saw this, we said, we use a multidisciplinary approach in almost all of our investigations. It isn't always a coordinated team multidisciplinary approach, but we do engage the child advocacy centers, and we do engage our community mental health centers, and we do engage the prosecutor as a key part of this also. And in every jurisdiction, there's a different level of resources in those jurisdictions to use. Obviously, the more populated the area, the more resources, but also the more demands on those resources. So all those things play a role in it. So if you look at words, Representative Humphries, words do matter. And so the first thing we saw was on page 1, line 12, that the law enforcement agencies shall implement. I'm not sure exactly what that is intended to be, but we read it as being we have to develop multidisciplinary teams if they don't exist already in the area. Now, they do exist in a lot of areas. Key components for this purpose in a multidisciplinary team are your child advocacy centers, community mental health centers, and sometimes your local hospitals, your prosecutors, law enforcement, all those are part of this. And we do work together pretty much across the state now. I can tell you in western Kansas, these are very serious cases, sometimes very complex. Human trafficking cases are extremely complex. And they require special skills as an investigator. They require special skills as a prosecutor. And those are challenging when we get into the rural areas. So what happens most of the time when law enforcement gets one of these reports, we reach out to the KBI for assistance because they have people that have been specially trained on these investigations. And so that's what usually happens in these. And then we reach out to, when we're dealing with the child victims, we reach out to the child advocacy centers and the mental health centers for assistance in that. So we approach them in the right way and we get them into the treatment as early as we can and all of those things. The second thing that stood out to us was the word team on line 13. As I said, we want to do what the legislative intent is when stuff like this comes up. And if the intent is to use a team, which means we have to have a team developed, that's one thing. If it means simply using a multidisciplinary approach as we deal with these victims, and we believe the wording in this is, again, on line 13, intervention in reports. So intervention would imply to us, we're talking about when we intervene and pull that child out of this dangerous situation they're in, not necessarily the investigation of the suspect, then it's right on target. So we're just concerned with that wording, not clearly understanding what obligation is being placed on law enforcement, especially in our rural areas. We want to do this. We encourage our agencies to use these models when we can, but that's our concern. But overall, I just want to be very clear. We support what is being recommended here in concept. We just think there's work needs to be done on the wording and the details in this to make it work. I wish I had a firm suggestion to you. I don't, but I'm certainly willing to sit down with Michelle or anybody else and see if we can work through some of these things.
Okay.
Time for questions.
Yeah, thank you. Thanks for being here. Are there questions? Representative Ousley.
Thank you, Madam Chair. Not so much a question. Thank you for being here, Ed. And thank you for the offer, because I know that we've been in this committee in prior years not exactly happy with the language in a bill as it's presented to us today during the hearing, but I know that, work happens everywhere in this building, and I think if you and Michelle could get together and kind of iron out some of the details so that the words do match the intent, I know I, as a committee member, would be appreciated.
Okay. Madam Chair, if I could add one more thing. I talked about the CACs. Just in case you don't know, I just pulled this off of the CAC website. There is one CAC that covers 34 counties. They have 6 locations within that COC that they operate. But there's also 30 counties that only have CAC services through what they call a courtesy basis. There's no formal agreement. And there's also 5 counties that appear to have no CAC coverage. So those are some of the challenges we have when we talk about developing a team, not the multidisciplinary concept, but a multidisciplinary team. And mental health centers are the same way. We have one community mental health center that serves 20 counties. We have another that serves, I think, 15, another one serves 10. So they're spread thin. Thank you.
Representative Johnson.
Thank you, Madam Chair. Also, for the newer members, Chief Klemp has served to unify the organizations in Kansas, such as the Chiefs of Police, Sheriff Association, Kansas peace officers, and it wasn't that way before. And it has been very helpful that he is able to meet with all of these groups, and you can rely on the information that he brings to you, that it is on behalf of those agencies. And I really appreciate it, Chief. Thank you.
Thank you.
Any questions? Okay, thank you. So that's all I show for proponents. I show no neutral and no opponents. So I'll close the hearing on House Bill 2153. Committee, I'd like to work. Oh, I've lost my number. I'd like you to pull out House Bill 2034. That's the Care Network. If you don't have that with you, you can let us know if you need help pulling it up. I just closed it. 2034. Does anyone have amendments? Representative Neighbor.
Madam Chair, could Jesse just give us a quick overview?
Oh, I'm sorry. I skipped that part. Jesse, would you give us an overview?
Thank you, Madam Chair. Thank you, Representative Curtis. As the committee remembers, House Bill 2034 deals with a program and process to medically examine a child who is alleged to be a victim of abuse or neglect. So what the bill does, it defines new terms to be used in the program. It outlines the process as far as when the referral is required and when the referral may be referred. And then if the referral is made, the process for getting that child reviewed and either examined, and then the confidentiality of such records, and then also what the Secretary of Health and Environment is required to do in order to implement and administer the program, such as paying the charges for the exam, putting together training, having a fund, and mainly paying back the providers. And the section would be a part of the Child in Need of Care Code, and I am available for any other very specific questions.
Okay, thank you. Committee, do we have any very specific questions? Representative Neighbor.
Thank you, Madam Chair. I would like to move that we pass out House Bill 2034 favorably, and so that we can have some discussion.
So Representative,
You're going to do it different.
I'm doing it different this year,
Okay.
asking for.
I take it back.
Well, no, you don't have to unless, if we don't, do we have any amendments? Okay, so I will recognize your motion then, and Representative Johnson seconds the motion to pass out favorably. Is there discussion? Representative Neighbor.
Thank you. I think we saw something last year where we were working with a group of pediatricians that were going to train other pediatricians in. That's okay. This is just bringing that one back. Thank you very much. It's a good bill.
So Jesse, do you want to go through the history of what happened with this last year, just as a reminder?
Sure. Yeah. Thank you, Madam Chair. House Bill 2034, the language was originally found in 2022 House Bill number 2632. It was not amended in this committee, but it was passed out. It was then to the House floor and it was amended. It passed the House floor 95-27, and then in the Senate, it died in Public Health and Welfare, where it was referred. In that same session, there was a proviso in House Bill 2510 to provide the monetary support to a program that provided medical exams for children who may be victims of abuse or neglect.
So with that proviso, the ball has started rolling as far as the education process. And so, any other discussion? Okay, Representative Neighbor, you may close.
Thank you, Madam Chair. I'm glad that my mind is not as far gone as I thought it was. Anyway, I will renew my motion to pass out favorably House Bill 2034.
Okay, it's been moved and to pass out favorably. All in favor, say aye.
Aye.
Opposed, no. Okay, thank you. That was much easier than anticipated. Do we have anything else to work? Okay, let's pull up House Bill, what was it? 2194, the Gail Finney Bill of Rights. Do we have any amendments? Oh, we'll have an overview from Jesse.
Thank you. I'm glad I still have a job.
Glad I still have a job. I keep forgetting.
Okay, so House Bill 2194 is known as the Representative Gail Finney Memorial Foster Care Bill of Rights. And what it does is it includes two bills that were introduced by the representative last year. And one section is a Bill of Rights for foster youth, and the second section is a Bill of Rights related to foster parents, in conclusion of two new rights for parents, such as submitting a report to the court, which already is in statute, and then request a court hearing regarding a change in placement, as found in statute also. So as remember, some of these are already in statute, and those that are existing in statute, that statute is referenced in the provision. I'm available for any specific or vague questions about this bill.
Okay. Any questions for Jesse? Representative Lewis.
Thank you, Madam Chairman. And I don't know if Jesse's the right person to whom this should be directed. Maybe other members of the committee have input, but what is your understanding of how this gets enforced? Is it by private causes of action brought by the children or their representatives? Is it through law enforcement? I mean, how does it get enforced if we know?
Jesse?
Yes, thank you, Madam Chair. Representative Lewis, I think private action would be the largest avenue for enforcement. It is silent as to how the enforcement would be implemented. With it being silent, that could open up a lot of avenues for, DCF to do something or contractors to do something. But eventually it would be a petition in the courts.
I just, the court would actually then, without any direction in the statute, I would think there could be some litigation over whether or not this creates a private cause of action, and whether we intended that or not to be the case.
Any other questions for Jesse? Okay. Now, are there amendments? Representative Neighbor.
Did you see any amendments? Thank you. Thank you. Madam Chairman, I would move that we pass out House Bill 2194 favorably for passage.
Okay, it's been moved by Representative Neighbor to pass out favorably, second by Representative Johnson. All in favor say, oh, no, further discussion. Representative Wagner.
Thank you, Madam Chairman. In just reviewing some of the testimony and somewhat jumping off of what Representative Lewis was maybe alluding to, where they said that this currently, I mean, I'm concerned in some regards on this. You know, one thing by calling something a right, you know, it does seem to, well, my rights have been violated, I should be able to sue or have some sort of recourse. I know DCF said that a lot of what is in this currently is sort of technically stated as, you know, something that shall happen anyway, and so we're not expanding dramatically. But again, we are putting it in kind of a Bill of Rights type of format, which just sounds litigation heavy. This bill does not have a mechanism for enforcement, which is mentioned in one of the conferees. So we're not exactly going down that path, but you know, we are starting down that path, which I don't know if that is really a wise public policy path, you know, to pursue ultimately, to make this like an enforceable action rather than something a little more, we aspire to this, not so much that you can sue somebody if this doesn't happen.
Further discussion? Representative Ousley.
Thank you, Madam Chair. And just following along comments and concerns here. I'm going to look at this not only as codifying policy into statute, which is the basic understanding of it, but also we had the Division of Child Advocate in front of the committee the other day, and I think it holds a little stronger weight when it's statute, not policy, as far as any concerns that could be raised within that division. So I could be speaking out of turn here, but I'm going to look at this as another tool in the toolbox of the child advocate for the state, and that's not going to hurt anything. So I'll be supportive.
Further discussion? Okay. Representative Neighbor, you may close.
Thank you, Madam Chair. For many of you that did not know Representative Finney, she was very, very, very dedicated to the foster care system. She was a foster care parent, and she worked every day for those children in her community and across the state. Many of the issues or items in this bill are already in statute. This is a codification. This is a clarity issue for me. And it just brings to the forefront how important it is for our children to be able to know and to speak on behalf of themselves, and also have the parents have a say, bring them together. So with that, Madam Chair, I would move that we pass out House Bill 2194, favorable for passage.
Okay, you've heard the motion. All in favor say aye. Opposed, no. Okay, motion passes. Well, that's all we have in committee right now that is ready to be worked. So we're going to actually make up some time. Oh, we have some minutes to approve. You've received the January 23rd minutes in your email. Carol said she hadn't heard back from anybody after a certain length of time. Is there a motion to approve? So moved. Motion by Representative Johnson to approve the minutes, second by Representative Neighbor. These two are working really hard today. All in favor say aye. Aye. Opposed, no. Motion passes. Okay, we will. We already did, but we can return to that order of business of bill requests. Yep. Oh. Representative Ousley.
Thank you, Madam Chair, and thank you for the committee's patience. My noon building construction committee ran long just in that committee room right over there. So I apologize for missing this in the beginning of the committee. But I would like to request a bill to take the communities that care survey from an opt-in to an opt-out like it was prior to 2013.
Did you give that RS number?
RS 0851.
Okay, are there questions regarding this? Representative Humphreys?
I didn't hear what it was that you're opting in or out to, sorry.
The Communities that Care survey.
Okay.
The other day when we heard the Child Death Review Board report in here, I know they lean upon that survey. I know I've had conversation with our community mental health director, and our community health center relies upon that survey, as well as the Department of Education. So I'd like to see if we can't get a little bit more participation in it.
Thank you.
Representative Wagoner?
Just one more part. Was this what we had voted on like maybe 2 or 3 years ago and children seniors 4 years ago? Okay, it's basically the same bill, or, okay, thank you.
Further questions? Okay, any objection? Okay, no objection, we'll request introduction. Okay, anything else? Okay, thank you, everybody. We are adjourned.